So let's talk about the anatomy of an upper central incisor. So just like posterior teeth, we have primary anatomy, secondary anatomy, and tertiary anatomy. The primary anatomy consists of the parameter shape, the line angles, and the emergence profile that we'll see. And then we have secondary anatomy, which is essentially the vertical anatomy that we can see. So it will be your vertical developmental grooves that we see on the labial surface. And then you have your tertiary anatomy, which is your horizontal texture that you'd see, where you're essentially seeing the pericomata. Now, when we're doing our composite resins, the key thing is we want to master the primary anatomy first. So we want to get the outline shape absolutely perfect. And the next thing we want to do is get the line angles, so the transitional lines where they should be. Now, these transitional lines are essentially the junction where the reflective zone, which is the facial surface or the buccal surface, meets the deflective zone, which is the interproximal surface. And where those surfaces meet, we get a transitional line. And the transitional lines, they play a role in the perceived width and shape of a tooth. So, for example, if you've got your line angles fairly parallel, what you'll find is that it makes the tooth look a little bit more rectangular. If you flare the incisal parts of the transitional lines, what that does, it makes the tooth look more triangular. Now, if you round your transitional lines, you can see that will make the tooth appear a little bit more round. So you can use different tactics to alter the perceived shape and size of your restoration.